Triggers for asthma usually fall into one of 3 or 4 main categories. Far and away the most common and potent in children are colds or viral infections in the upper respiratory tract. The average child in the first couple of years of life averages 8 to 12 colds per year. Most of those come between October and April, so if you do the math you can figure out it's about every 2 to every 3 weeks through that time frame that you'd expect them to get a new cold. And each of those colds can last a week or two, and so sometimes through that period of the year they can have triggers going on as often as that they don't. The second category is allergies, and the third category is irritants. Allergies mean that your body has an antibody so that you overreact to something specifically. The example I always use, you have 10 asthma patients in a room and a cat comes in the room. The 2 that are allergic to cats start having more problems, whereas the other 8 don't even notice. Those 2 carry the antibody so that they overreact to the cat. Irritants are things that just directly irritate those sensitive or twitchy airways, and you don't need the antibody for that. So same 10 asthma patients in the room and somebody comes in smoking, all 10 of them are going to have problems. If they don't need that antibody, the smell of the smoke itself can directly irritate those sensitive or twitchy airways. Anything with a strong smell can be an irritant. So perfume, potpourri, deodorizers, cleansers, any of those kinds of things can be a trigger for the asthma. The fourth category is relatively common, so I'll bring it up now just briefly, and we'll talk more about it if it's appropriate, but that's reflux. Reflux and asthma commonly can get tied together. Anybody who coughs hard enough is going to have reflux, and all that stomach acid has to do is to come backwards to about this level, and it can trigger the asthma, which then causes more cough, which then causes more reflux, which then triggers more asthma, and you go round and round and round. And sometimes we have to treat both problems at the same time to really break that cycle.